Hello and welcome to Weekly Inkblot, episode 9, Bipolar, or otherwise known as manic depression. Um, this is one of those disorders that not all of us have a lot to talk about or to say on it because we don't have it, but Ellie does, so she can talk from first person experience and from also having family who's bipolar. Um, I guess I'll start with what the dictionary says about it. It's a condition in which people go back and forth between periods of very good or irritable mood and depression. Um, so basically, you kind of flip back and forth between whether you're in a period called mania, which I have a nice little list here as to what that can entail. It doesn't mean like excessive happiness. It can in a way, but a lot of times it's not. That's not actually what's going on. Um, the mania can include excessive happiness, hopefulness, and excitement, sudden change from being joyful to irritable, angry, and hostile, restlessness, increased energy, less need for sleep, rapid talk, distractibility, racing thoughts, high sex drive, tendency to make grand and unattainable plans, tendency to show poor judgment, like impulsively deciding to quit a job, inflated self-esteem or grandiosity. So basically, that's unrealistic beliefs in one's abilities, intelligence, and powers. Increased reckless behaviors, such as lavish spending sprees, impulsive sexual indiscretions, abuse of alcohol and drugs, or ill-advised business decisions. Um, so that's the manic part, and then the depression part is similar to what we've said about depression before: feeling sad or blue, loss of energy, feelings of guilt or hopelessness or worthlessness, loss of interest or enjoyment from things that were once pleasurable, difficulty concentrating, low energy, feeling physically or mentally sluggish, restless, or agitated, increased need for sleep or inability to sleep, which is insomnia, change in appetite causing weight loss or gain, and thoughts of death or suicide or attempting suicide. So basically, what happens with bipolar disorder is they go back and forth between being manic or being depressed. And sometimes it has its specific, like, what's the word I'm looking for? A pattern. Like, sometimes, like, it's a gradual, they're in a manic phase for about a week and then down into a depressive phase for like 2 weeks, and then but sometimes it's really erratic, and sometimes, like, it used to be said that it's not a quick, like, it doesn't happen quickly, but that's actually, they've realized, is not true. Some people with bipolar can go back and forth between it very rapidly.
And that is actually the type of bipolar disorder I have.
Hmm.
Um, I mean, it's hard to say. Uh, Bipolar disorder, I mean, for anybody with intense emotions, it works very much the same kind of way with the intense emotions. The only difference really is, I mean, sometimes it's a trigger word, sometimes it's just out of nowhere. You can go from being happy and smiling and laughing to breaking down and sobbing and throwing things and angry. And like, it could be anything as simple as like a trigger word. It could be, Lord only knows what.
Hmm.
It can be very random. Um, you know, and it is actually one of those mental illnesses that can be inherited. Um,
Hmm.
both of my parents have bipolar tendencies, and my mother is actually bipolar. She was diagnosed with manic depression.
We just lost sound on you.
Oh, really?
Oh, here we go. There we. All right, you're back. Sorry. Eh.
No, but bipolar disorder is kind of difficult to live with, especially when you're around, other people and you're having one of those episodes because, you always kind of feel a little embarrassed afterwards. Because really, once you get to that point, you can't really control it anymore. Like once you flipped, you flipped. It's until it's run its course. There's no immediate comeback.
Mhm.
So, I mean, and it can go the opposite way. You can go from angry, screaming, and throwing things to laughing and calm.
And it's completely confusing to loved ones, especially when they don't know um, that you have bipolar, or before you know you have bipolar, and so everybody's kind of sitting there going, "What the hell just happened?" Because it's sometimes like it can be like that, and you're sitting there left to try to figure out like,
What the heck just happened?
yeah, like I blinked and everything changed. Like,
Yeah,
what just, how is this possible?
yeah. And there's really no easy way to explain why, you do that. It just does. Most of the time with bipolar disorder, you're not looking at, calm, gradual emotions. You're looking at generally switching between intense emotions,
Hmm.
drastic changes, not like, you just go from mildly irritated to, okay, I'm all right. No, it doesn't work quite that way. You go from rage to calm or from, happy to upset.
Hmm.
And there's no telling, whenever there are sometimes patterns. Like sometimes if you're paying close enough attention, you can sort of see what the triggers are for them. Like you can see what's ticking in their head, the signal that something's about to occur.
Mm. There's actually a couple different types of bipolar. Bipolar one, um, and both of these are considered called manic depression, but bipolar one really is the one that when you talk about manic depression, it's usually what you're talking about. This has both periods of mania and depression, and this one usually has its pattern. Like bipolar one tends to be more pattern. Like you can kind of get an idea um, what the pattern is doing and work against it. Bipolar two is similar in that it has the periods of ups and downs, but in bipolar 2 they never actually reach full mania. Um like they have some manic symptoms, but it does not turn into full mania. What they call it is actually hypomania. Um is what bipolar 2. And then they have one that I've never heard of before until now, cyclothymia or cyclothymic disorder. It's has the mood swings between short periods of depression and hypomania. These mood swings never reach the severity of major depression or mania. The pattern is usually irregular and unpredictable, and this is it's a much milder case of bipolar, but it's still considered a bipolar disorder
Yeah,
because you do switch back and forth. I mean, that's the, bipolar. Like what we're talking about here is if we want to break down the word, bi meaning two, polar meaning like opposite ends.
yeah. But you're
So,
you're not looking at the gradual of, calm to irritated to angry. You're looking at almost opposite ends of the spectrum
hmm.
emotions. I mean, for most women, and this sounds like really stereotypical, but for people who are going through their time of the month, um, or, pregnant women, mood swings. Um, it's like that all the time. And in fact, for me, those periods are lessened during my menstrual cycle. I have less problem with my mood swings then. Although my mother maintains that I get what she calls ballsy, which means I get a little bit more daring during those periods.
Which means you're probably a little closer to mania during that time.
Yeah, but
Yeah.
it's winds up staying a pretty steady reaction throughout the whole thing. So I'm not really flipping during that time period. It's staying in about one emotion.
And like with all of the disorders that we've talked about up until now, I mean, other than anxiety, um, bipolar can include psychosis. Just like there is psychosis in depression, with all of the other disorders that we're going to be looking at, well, most of them anyway, not all of them. I can't generalize like that, but a lot of them include um, their psychotic episodes for certain people. Like, one person with bipolar may never get any sort of psychotic episodes, but then another person with bipolar might have them all the time.
Yeah.
Like my brother-in-law, um, he has bipolar with psychotic episodes, and he hears voices a lot. They tell him to do things. The night before my wedding to his brother, I found out later after the wedding that they told him to take a full bottle of Advil, and he didn't. He managed to talk himself out of it, but it was, I could tell at the wedding something was off. Um, but he wouldn't tell me, and then later he he admitted to what was going on and that he hadn't told me because he didn't want to ruin the wedding. And there's actually different types of psychosis. Um, since we're talking about the two sides, um, psychosis also works in two sides. Um, the manic side is the hearing voices, false beliefs that they can't be swayed from, and belief in superhuman powers, or sometimes people will feel like they're godlike, that they are indestructible, that they can do anything, and that that they're untouchable, and that's obviously not true.
Yeah.
Um, and it's very dangerous.
Yeah, not only to themselves, but to other people.
hmm And then the depression side of it is delusions of guilt or worthlessness, a belief of being ruined or having committed a horrible crime or terrible sin, as one of the sites put it.
Um, and bipolar disorder is one of those things, and I've noticed this a lot. It seems to be one of the more misdiagnosed
hmm
mental illnesses, and it seems to be a catch-all. For, I mean, you get a lot of parents with teenagers who are acting irrationally, who don't know what else to do, and again, when you have a lot of hormones going on, you're gonna go through periods that seem very much like bipolar disorder. So
Teenage hormones are the worst.
yeah, and they can be incorrectly diagnosed as
Mhm.
bipolar disorder, which happens so often.
Yeah, uh, bipolar and ADD or ADHD are the most commonly misdiagnosed or overdiagnosed
Mm,
um, problems in the mental health world. Um, we use bipolar and ADD kind of as a blanket statement for uh, we don't really know what's going on.
yeah, and you've got doctors like, oh well, it's probably bipolar disorder, it's probably ADHD. No, it doesn't mean it's that. It means
Mm,
that for whatever bizarre reason they're going through a phase, because eventually when the phase is over, they go back to being normal. Bipolar people don't ever go
No.
back to being normal. It's like that for the rest of their lives.
And then yeah, bipolar is one that you don't have a chance to be cured from it. You can learn to manage it with medication, with therapy, with coping mechanisms, but you will always have it. You will always be bipolar, and so this one's a little bit different than like um, depression and some of the anxiety, and even we'll be talking about borderline personality disorder next week, and that one I think there is the chance to get rid of it, but like things like bipolar and like schizophrenia and I know there are more, but there's a handful of ones that you will always
Yeah.
be. And it's about reconciling your thoughts with the idea that like some people get really depressed about this because it's like, oh well, I'm never going to get better. That's not true. Um like I've come to with my depression, the way that things have happened, the abuse that I went through, um everything leading up to now, it's changed my brain chemistry. And I know that I'm going to be on antidepressants for the rest of my life. That's not to say that I'm not going to learn how to manage it and be in eventually maybe a state of remission. It just means that my state of remission is because I've worked hard and because I take my medication.
For those of you who have been diagnosed with bipolar disorder and do actually have it, um, yeah, it can be managed. And you don't necessarily need medication to do it. It kind of depends on how bad your bipolar disorder is.
Mm-hmm.
But the first step is one, you need to be as upfront as humanly possible with the people that, your friends, your family, whatever, that this is an issue. Two, you also need to make sure that you yourself know that this is not a crutch. Yes,
Mm.
this is a problem, but you are responsible for the things that you do and say during those periods of mania. So you also can't really use it as an excuse just to, explode at somebody. If you do, you also have to understand that, especially if if the people that you exploded at already know about this problem, that they're trying to. It's not always easy to live with. But if
Mm.
you find one of these mania, whatever is more comfortable for you, be that talking to somebody, um, screaming into a pillow is always a good thing. If it at least gets the initial burst out, um, it's
Crying is
is a good thing.
it's a good release.
Yeah.
I had a friend recently. She was holding in a lot of anxiety and whatnot. And having these panic attacks that she was trying to not let happen. And I told her, I was like, just cry, let it all out, get it out, and then when you're done, stop and be like, okay, now what do I do?
Yeah. It's sometimes it's always hard to catch yourself. Throwing things is generally not a good idea.
Yeah.
Break things. But if you can help it, punch pillows. I know some people think that pillows aren't sturdy enough for that kind of thing because they're so lightweight. In which case, make yourself a punching bag, and you can do that with some duct tape, some
Mm-hmm.
garbage bags, and some old towels, clothes that you don't really wear anymore, and just wrap it up, and you have a punching bag to start trying to get out some of that anger. Because some people are verbally manic, some people are physically manic.
Mm-hmm.
And, because some people the people who are verbally manic can generally cry and let it out or scream and let it out. The people who are physically manic usually need to actually physically react to start, the process of getting through it. And it's always better to have the option of hitting something that isn't going to break and isn't going to hurt anybody or yourself.
Mhm.
You know, hitting walls, not a good idea. You're going to bust up your knuckles, you can, ruin your security deposit, and
Yep, property damage, and then you've got to fix it, and and
again,
it, and
it's
it's and you can also scare people
yeah,
because if someone were around me, like, if my husband were bipolar and he was punching walls every single time he was getting upset or whatnot, or we were fighting or something, um I would feel like I was in danger.
yeah.
So
I mean, I am more verbally expressive in my bipolar. My sister is more physically expressive in her bipolar. Hitting things, throwing things, slamming doors. Um, the feeling for her of making contact and doing something physically to express those periods of mania. As somebody who expresses it verbally, I do have to watch very carefully and try and remember what it is I've said, because I can get angry and say things that you can't take back, and that is something to keep in mind. Once
yeah.
said, you cannot unsay it. You
Mm-mm.
can apologize for it and remember what it is that you've said, but you can't ever take back what you've said.
Mhm.
So it is important sometimes to, if you can, to try and stop yourself and think about what words are going to leave your mouth before they leave it.
Your best defense against anything when it comes to these types of disorders is knowledge. When I first found out that my brother-in-law was bipolar and that he was having a lot of issues with it, that first Christmas, I bought him a book that was specifically about um, learning and dealing with bipolar. It was very highly recommended. I do have it, but I have someone's reading it, so I can't tell you the the title right now. But I bought him the book and I bought us the book, and I told him, I was like, I just want you to know that I didn't just buy one book. I'm not just giving you the book. We're reading it too, and we're
Yeah,
learning. And in anything that we can do to help, we're there to, if he needs to yell and scream, or he needs to rant to someone, or he just needs someone to drive him somewhere, like when he's really upset or something, like, whatever he needs.
yeah. It is also important to understand that while somebody may tend to be verbally manic, it does not mean that they are not physically manic. Um, During some of my more intense manic episodes, I have been known to get physical. And again, that is when you're at your most dangerous and you can do a lot of harm. But then it's so easy to slip into that and not think about what you're doing.
Hmm.
And by the time you're done, you feel horrible. You are horrified at what you were just capable of doing. I have been known to hit, throw, uh, you name it. I mean, it's really not easy. And my mom suffers from something very similar. Generally, as long as she's screaming at you, you're safe. When she stops screaming at you in the middle of a manic episode, move. And that's the same for most manic people that slip into that. When they start getting ridiculously physical, it's time to just leave them alone. Understand that one, it is not your fault that they are throwing things. Two, they're going to regret it later, but at the moment, all you can do is step back and eyeball the situation and make sure that they are not harming themselves.
Hmm.
Um, do not put yourself in the position over objects. If objects get broken, fine. But it's better than you wind up being hospitalized and them paying the regret price later.
Mm-hmm.
Just if they start hurting themselves, the best you can do, call 911. Um, call somebody who maybe does know how to talk them down, something. But do not put yourself in danger to try and get them to calm down.
Mm-hmm.
The moment will pass. Some people, when they go into mania, will not let the people in the room leave. And at that point, the only thing you can do is just try and keep a piece of furniture between you and them. These are extreme cases. This is not everybody. This is not an all-the-time thing. This is, and it happens every once in a while. They get those really bad manic phases. And those are usually the ones that are really, really fleeting. And you're probably talking a good 5 to 10 minutes tops of this just uncontrollable rage. And it could be for something stupid and simple as you forgot to wash a dish.
Mm-hmm.
Or they're mad at themselves, or, they're mad at their day. And it's just, and you just said something the wrong way. It's not your fault. It is never your fault that they are having a manic episode. It's not their fault that they're having a manic episode. What they do is their fault, but it is not their fault that they're having a manic episode.
Mm-hmm.
And it is important to remember.
Yeah.
And most of the time, they don't realize what they're doing. They don't realize what they're saying when they say it. It just comes out. It's sort of like word vomit. It's freaking, it doesn't even make sense sometimes. You could be arguing about the dish and suddenly they've moved on to this conversation about a stain on the carpet. Or, something that happened 6 years ago that you don't even remember. Or they're talking about somebody you don't even know. I don't really know. There really is no one way to tell when those are coming either. And like I said, they don't realize what they're saying when they're saying it half the time. They don't realize what they're doing half the time when they're doing it until, after the fact, and that you can see when the realization hits.
Mm-hmm.
When they're done, and it's that moment of, you can see it in their facial expressions of, what have I just done?
And like with a lot of the disorders that we're going to be talking about, personality disorders especially, this is true of bipolar as well. You have to be willing to admit that you have the problem in order to fix it. You have to be willing to say, I'm bipolar, or else you're not going to be able to fix it because, you know,
One of the biggest moments of child abuse for me and my sister was fueled by one of my dad's manic states. It was one of those mania periods that got us taken away from him. And it was over something so small. My sister just woke up his girlfriend's little boy, and he flipped. And if you ask him now why he did it, he can't give you an answer. He doesn't know why. It happened. Recently, thank God, he has finally come to a point where he can face what he did and admit that he did it. He still cannot tell you why he did it, because there isn't a reason. It just happened. And it doesn't make it right, not by any stretch of the imagination. But to give you a hint as to, what manic periods can do to people around you, that's that right there is a prime example. I mean, people can be taken to jail for their actions during these periods because of what
Yep.
they do is so harmful.
Mhm.
You know, you have to admit that you have the problem and work to manage and fix it.
Mhm.
For some people with, particularly in the more explosive manic depression and bipolar disorders, um, anger management actually does help. It has shown to help
Mhm.
give you the techniques for learning how to identify when you're about to have one and for how to rein it in a little bit. It doesn't make it completely go away, but it does give you some really handy tools. So, I mean, if you ever get really worried about your manic depression episodes, anger management is really not that bad of an idea.
Mhm.
You know, there's a lot of stigma, you know, attached to anger management too, but you know, it helps so many people. Because while, you know, you're dealing with people who are angry like that, you know, more often than you are, it will give you some really good coping mechanisms and really good tools for how to handle it and help you face your own anger issues during those periods.
Mhm.
And it really does go a long way, but you have to help yourself.
Mhm. And when it comes to ways to deal with this disorder, learning like a lot of the DBT and the ACT skills are very important, along with for some for I think for I don't know the percentage. For a lot, medication is the way that you have to go. Um, Obviously, for some, that's not necessarily true. Um, but if you have people constantly like, around you, your loved ones, making like telling you that you are not handling it well on your own, you know, don't stay in that delusion that you can handle it by yourself. Sometimes you do have to go towards the medications. They use a lot of the same medications for both sides of the coin for bipolar. Um, Usually, you'll see a lot of antipsychotics and lithium
Hmm.
is a big one um, that's used. During like manic episodes, they'll use things like antipsychotics, benzodiazepines, which is for anxiety, and lithium in order to control the episode very quickly. And then they add a mood stabilizer onto it so that you don't go down deep into the depression area. In depressive episodes, they use otherwise lithium, an anticonvulsant or an antipsychotic, and what they're trying to achieve during those is by modulating moods without igniting a manic episode. And some people you'll be taking the medication every day. Um, because this was brought up with a couple of people now. There are some, like, if you would rather go a more holistic route, I guess is what it's called. Is that the right word?
Holistic medicine or, you know, natural
Yeah,
stuff.
natural remedies, um, or home remedies. Um, there's two big ones I wrote down. Um, the first one is omega-3, and this is actually good for a lot of people. For one thing, it helps with like
Thank you.
with your brain and mental functions. If you're having like I have a lot of memory problems, and it's supposed to be really good for that. But this omega-3 is it deals with the production of hormones and nerve tissues. Um, so this is good for the depression side of it, not the manic side. Um, if you're going to use this, you should be looking on the bottle. A lot of the sites were saying that in order for it to be effective on bipolar, it must contain both EPA and DHA. The other big one is St. John's wort that people have used.
And
Um,
you can find these at CVS and
yes, you can.
drugstores.
Um, this usually can be used to treat mild to moderate depression. And it may improve sleep because it increases the brain's output of melatonin, which is the natural chemical that the brain creates. Like when the sun goes down and it gets dark, your brain sends a message to start secreting melatonin to make you tired, so that you will sleep at night. And a lot of people with depression have lower levels of melatonin in their body, and so this can help that. Um, this is the only thing that there's two warnings on the St. John's wort. One is that it can apparently cause manic episodes if you're not careful. And the second is that you are not supposed to be taking it with SSRIs, which is something serotonin reuptake. Or see, if Ash were here, she'd know exactly what it is. I always forget what these means, but this is a specific type of mood stabilizer. A very because there's two different types of mood stabilizers. There's the SSRIs, and then there's
MA, no, MAOI, yeah.
MAOI. There's one more too because I think that there's one that's like SNR. I want to say SNRI, but I might be wrong. Don't quote me on that. Um, I should be looking this up. I know. Um, but I guess St. John's wort and the SSRIs can selective serotonin reuptake inhibitor. That's what the SSRI is. Um, and but so I guess that these have side effects that they interfere with what the other is trying to do. So you should not be trying to take it with those. Always consult your doctor before you start on any of the natural remedies, because you'd be surprised like how many of the natural um, herbs and supplements can affect your other medications, because it's still a drug technically. I mean, yes, it's a natural drug, but it's still a drug. It's still affecting your mental facilities, and so it's going to work the same way as any medication. That there are going to be interactions and side effects that may not be good. So you should always talk with the doctor or your pharmacist before mixing them like that.
Yeah. There's tricyclic antidepressants, which is the third category of medication.
Yeah, we're gonna, like, we're gonna go into a lot of the medications later. So
Yeah.
and if you guys need that information, you can go to our Facebook page and ask, and I can provide links for you. Um, so I'm looking up lithium real fast as the medication because I realize I don't know as much about it. It's
Lithium has been one of the longest running medications, and it used to be sort of a blanket medication for anybody with mental illness.
yeah.
They just sort of gave it to everybody regardless, which is very dangerous, um, which they know now. But it has proven very effective in some cases of extreme bipolar disorder.
Yeah, in ionic or salt form, it's used as a psychiatric medication. Um, it's it as a mood stabilizer, lithium is probably more effective in preventing mania than depression and reduces the risk of suicide in bipolar patients. Um, and it's saying that in depression alone, it can be used to augment other antidepressants. Um, but this is a big one. Lithium goes through, it gets distributed in the central nervous system and interacts with a number of neurotransmitters and receptors, decreasing norepinephrine release and increasing serotonin. So, I know her sister's on lithium right now.
She is actually on lithium for a mixture of, for right now, really, for something called unipolar, which means that basically you are, at least according to what Emmy has read, basically you're in deep depression constantly.
Yeah,
And
you don't,
for
and you,
somebody who's in withdrawal from something like a drug withdrawal, that's
especially something
fairly,
like especially something like meth,
yeah,
because that really screws up your ability to feel happy emotions after that.
yeah. And keeping in mind, she was bipolar prior to this.
Yeah, unipolar, it's basically what it means is that there are no manic episodes. You are just in a deep, deep depressive episode all the time. Like it's like you can't just come out of it. Like you're almost stuck there. And using things like meth is a good way to put yourself there. Um, Even if you weren't bipolar, like I have a feeling that a lot who are bipolar probably end up being unipolar, and those who are bipolar would end up going towards unipolar after meth take.
Yeah.
And we are going to talk eventually about drug addiction and how that works and how the between different drugs and how it affects family life. Um,
We also learned something really interesting a couple of weeks ago. There's something called tripolar, and it's an unofficial term. It's not officially recognized
yeah,
by the
that's
medical
talking.
profession.
What that's talking about is when you go between the emotions of deep depression, manic episodes, or severe anger. And when we were looking it up, I said to both Ellie and David that I really I can understand why it's not an official term, because anger in and of itself usually tends to be it's covering up a different emotion. If you're angry, a lot of times, a good way, and we're gonna go through anger management stuff eventually, but we can start right now in the idea that anger is usually an emotion that we feel while we are feeling another emotion, and sometimes it can be used to cover up the emotion. Like, you get angry that someone said something because you don't want to admit that it hurt you or that it upset you, or you get angry because of an injustice, which that's completely normal. Um, Getting angry because you're sad, or sometimes anger is used to cover up good emotions too. I mean, well, as we learn in ILP, there are no good or bad emotions. There are just emotions. They do not come in the range of good or bad. It's that we have put the label of good and bad on them. And sometimes, extreme elated feelings to certain things are not, it's not the correct way to deal with it or feel about certain things. But anger is, in and of itself, usually is covering up something else. So if you are having severe anger, one of the first things you need to start asking yourself is, what am I hiding?
Yeah.
Um, so I feel like right now it shouldn't really be listed as one, because the anger is probably covering up both sides of the coin on that one.
But I mean, the term exists. But it's an unofficial term, and it's
It's not used by the medical profession
yeah.
or in the DSM
So
at
at the
all.
moment, it is not a currently recognized form of mental illness.
Yeah.
It's sort of one of those bizarre unofficial terms. And who knows, maybe, 10, 20 years down the line, maybe that will be an official term. But
Yeah,
for the
it could be.
moment, it isn't.
And who
So,
knows what we'll know about bipolar within 5 to 10, 20 years. I mean, psychology really is a new science. It's one of the newest, that is maybe only, like, officially 50 to 70 years old. And that's really not that much time. Like, at the most, I think it's 100 years old. But I don't want to. I feel like 70 might be the right number. I don't remember now.
I think you're looking at a little bit over 100. They were starting to delve into it in the very last decade of the
A
1800s
little bit.
and the 1900s.
A little bit, but they didn't actually start making it a science of, like, really studying, like, the
Yeah,
brain chemistry and all of that until, like, it just like, not that long ago. 50 to 100 years, that's really not that much time at all. And I have a feeling that within 20 years, when it comes to things like bipolar and depression and anxiety, I think we will be even further along. I hope that's true of other disorders.
yeah.
Um,
I mean, keeping in mind, I mean, we discussed this during the history portion. I mean, up until the early part of this century, or the 1900s, I mean, most of mental illness was considered a dysfunction in the fluids in your body, not really a brain dysfunction, but as the humors, more or less, which, there's something to be said that they identified it with an imbalance of something
mhm.
as early as, the medieval era, but they didn't really equate it with the brain being something wrong. Um, so we've come a very, very long way. We've come a very long way in understanding that how we treat mental health patients does affect their brain, which is why we see less and less of these, asylums and things like that being run the way that they used to be. We don't see electroshock treatments the way they used to do it.
Mhm.
Trained medical professionals are entrusted with the care of people who need to be there instead of, just some random guy that got hired. Um, and like I said, and as Emmy said, this has really, really been within the past 100 years
Mhm.
ish. This,
We've come a long way, but there's still a lot more
who knows?
steps to take forward.
20 years from now, what we do now may be considered barbaric, and they
Yeah.
can fix any mental illness by, like, touching you on the head and going, hey, you're good to go. We don't know. Who knows what the world of science will discover?
Mm,
But until then, I find it so hard to believe that, you know, because as long as humans have lived, there has been mental illness, and I find
mm,
it really just astounding that the stigma has lasted as long as it has, given the, amount of time that mental illness has been an issue. But it has, and you
which is
know,
why we're here now, because this is all about a fight to end this stigma and to treat mental illness as it is
yeah,
an illness
you know,
and something that needs to be taken seriously and should not be the butt of all of the comedians' jokes
yeah,
or the thing that you avoid talking about at the family reunion.
yeah. That's the one of the biggest mistakes that a family can make is not addressing the problem or acknowledging that there's a problem.
Yep.
It's okay to have somebody in your family with a mental illness. It's okay. It doesn't make them any different. They're still the same person. What they need from you is support and, a shoulder to cry on or an ear to talk to when they need it.
Hmm.
And, you know, it's important not to judge, the people that do have mental illness. There's so many of us that do.
We didn't ask for this. We don't enjoy it. We don't sit here going like, haha, this is so much fun. Like it's hell for us.
Yeah. You know,
So,
the ones that always get me are the inherited ones. And you have parents that sit there and go, I have no idea where you get this. They got it from you. There is, I mean, especially with like inherited one, it's nobody's fault. It's
mm-mm,
just there. There's some mental illnesses that can be attributed to other people's actions and doings of, hurting and victimizing other people.
mm,
But, you know, there again, those people didn't ask to get those problems. It's believe me, if we had the choice, we wouldn't have them.
yeah.
We would much rather live without it and just go on with our lives. We don't have that option. What we do have is, the ability to communicate with each other and find ways of coping and managing our lives with it.
Hmm. And
And
so
it can be hard work,
it is hard work.
but the end result is far more rewarding.
Mm. So, next week Ash will be back with us, because we will be talking about BPD, or borderline personality disorder, which people tend to kind of flip back and forth sometimes with the diagnoses of bipolar and borderline because they do have a lot of similarities, but we'll find out next week what the main differences are.
Yeah, we'll find out where those similarities end, because they do end.
Oh, they do. And, you know, we will talk about what exactly personality disorders are and what borderline is, how it affects you, what kind of treatments there are, and how people come about it. So, see you guys next time.